we're talking about cervical cancer screenings and preventions. Doctor, good morning.
Good morning.
Well, let's start, of course, with what exactly is cervical cancer?
So cervical cancer is a cancer of the cervix. There are several different organs within the pelvis of female reproductive organs, and the cervix is one of them. So it's the lower part of the uterus, and it's what connects the uterus to the vagina.
Okay, and what are some of the leading causes of cervical cancer in America right now?
So cervical cancer is often thought to be having a genetic cause, but that's actually a misconception. The majority of cervical cancer cases are caused by human papillomavirus, or HPV.
And when you're talking about cervical cancer, if someone is out there watching, what are maybe some of the signs or symptoms for them to even think about maybe I need to be checked out?
Well, unfortunately, in the early stages of cervical cancer, or if they have precancerous lesions, there's not a lot of telltale symptoms or signs. Later on down the road, if they develop cervical cancer that has spread to surrounding tissues, they may develop pelvic pain or vaginal bleeding.
Now, when we talk about cancer, obviously one of the most important things, no matter what cancer we're talking about, is every doctor comes in here always talks about early detection and finding this early. So for our viewers out there who may be concerned about this, what are some measures they can take now to get ahead of what might be a problem in the future?
Yeah, definitely. I feel like if we can get ahead of the game, it's always better to prevent it rather than have to treat it down the line. For cervical cancer, we have two main prevention techniques. One is that there is a human papillomavirus vaccine, so it's called the HPV vaccine, or some people know it as Gardasil. HPV is a sexually transmitted virus, and like I said, that's how most cervical cancer is caused by. And so with the vaccine, we're trying to get kids vaccinated around 9 or 10 years old before they're sexually active, but it is something that adults can get as well if they feel they would benefit from the vaccine. Besides the vaccine, we do Pap tests, and so Pap tests are cervical cancer screening where we do a swab of the cells on the cervix, then also test for the human papillomavirus. So this is a test that either your OB-GYN provider can do or a family practice doctor, and they can do a Pap test, and if it's abnormal, they'll send you to an OB-GYN for further evaluation.
Yeah, so there are options for people out there.
Yes.
And Dr. Hewell, we do want to mention, if people are curious about learning about more of those options, or even just maybe starting this conversation with you and the other doctors at the clinic, where can they find all that information?
So we have a lot of good information on springfieldclinic.com, and then we're under Center for Women's Health.
Simple as that. Dr. Hewell, we appreciate you coming in this morning and sharing all this information. Find out more information, of course, on the Springfield Clinic.
Thanks for watching. Make sure to subscribe to our YouTube channel and watch more videos from News Channel 20.